Okay, so we're going to be covering the spinal cord. We're going to begin with the cervical region, which we cut from approximately C1 to C7. This is actually the process of T1, but this region encloses the cervical spinal cord. Right here we reflected off the left side of the dura mater. Let's see that. Nice and clear, that's nice fibrous material. You can see the layer that's intimate to the spinal column, or to the spinal canal. Spinal cord, I'm sorry, which is the pia mater, and the matter in between the pia mater and the dura mater, which you can see its remnants, would be the arachnoid mater. Over here you can see very small vessels, being the spinal arteries and the spinal veins, which I can't get my probe under here. We can see that. Here we can see the branching of the nerves. We have the posterior spinal rootlets, you can see. And those will come together to form the spinal nerves, which you can see out here. These spinal nerves will dive a little deeper. You can see a small enlargement being the spinal ganglion. And going further down, which is going to be difficult to see, but you'll see the dorsal and ventral rami as well. Okay. Let's see. Anything else I want to show you over here? Just before we move on to the lumbar region, I'm going to show you a ligament called a ligamentum flavum. Okay, the ligamentum flavum is on the posterior side of the vertebra. You can see, and it just holds all the vertebrae together on the side of the spinous process. So to reference, ligamentum flava. That's how that fits right there. Okay, let's move on to the lumbar region. Just hand me some light. Beautiful. Okay, again we have our two sides of the dura mater pinned and reflected, as well as the end of the spinal cord as we know it into the cauda equina. So this region right here, when we separate from the proper spinal cord into the cauda equina, that's around L1, L2, depending on the height and the age of the patient. You can see the individual strands of the cauda equina, as well as this structure right here in the middle. This whole structure is referred to as the phylum terminale, with the first section, between about here and here, referred to as the conus medullaris. And the phylum terminale will extend all the way to the bottom near the sacral region to help anchor the spinal cord and keep it from floating on up. Over on the lateral side of the spinal cord, you can see these attachments. Okay. And we'll do it again on the patient's right side, cadaver's right side. Nope, not that. Right here. And right here. And we have those as the denticulate ligaments, which attach the spinal cord to the dura mater. Again, just to iterate another point, as we saw spinal nerves on the cervical region, we have more spinal nerves here, which, again, we haven't exposed fully enough to see both ventral and dorsal rami. The last thing I'm going to leave with is the two regions of the spinal cord known as the lumbar enlargement, and up here, back here, we have the cervical enlargement. They're just small areas where they're slightly enlarged due to the presence of the extremities. We have more nerves going to the left and right upper extremities, lower left, right extremities. In this region, the cervical region, is about C5 to about T2, and then the lumbar enlargement is around L1 until about right above L1 to the start of the cauda equina. And that should be it for the spinal cord.